Nisha Jackson's in the house. What can I say? The temperature just went up. And we're here to talk about all kinds of good things. By the way, we're going to open the phone lines today and give you a chance to be a part of the conversation and take advantage of Nisha being here. She heads up Ventana Wellness. The phone number is 776-5368. And if you're outside the immediate area, it's toll free at 1-800-373-5368. All right, you got an event coming up tonight. Cholesterol. Here comes the facts.
Yes. We're going to give information tonight at the Smullen Center. We're giving a lecture. We, meaning myself, and also Dr. Joel Klein, who
is so passionate about that topic.
He is very passionate about cholesterol and heart disease and giving people more up-to-date information on how to avoid getting the diagnosis of high cholesterol or high bad cholesterol, but also giving them information on how they can be preventative against that. Or if you're taking high cholesterol medications, how to get off of them and what you can do in your own life to try to get off those medications.
All right, tonight at the Smullen Center, it's free and you're welcome to attend, and it'll be from 7 to 9, so it's right there in the parking lot at RVMC. Let me encourage you to go. What an opportunity to hear firsthand and talk to Nisha and talk to Dr. Joel Klein. Wow.
Yes.
It's a big issue. You know, you hear all these numbers and you're kind of going, all right, so what's the deal here?
Well, you know, I think it's interesting. My lecture is actually going to be focused on hormones in the heart.
Of course.
Because, you know, I like to tie those hormones in. And I'm going to be really focusing on men tonight, although I'm going to address women and hormones too, because I think women taking hormones is one of those very confusing topics. Women want, do I really need to take hormones? What is it really doing to my heart? So I'm going to address some of those issues with women. But I want to spend some time tonight talking about why men need testosterone as they age and how it positively affects their heart. So it'll be really interesting, and I think I'll be giving information about hormones in the heart for men and women that they did not previously know.
All right, and let me just say again, what an opportunity. Call right now if you want to be a part of the conversation, 776-5368. You know, I have to say this, Nisha, you and I have been doing shows for a long time. You're one of the beginners in this whole issue of hormones, and especially the lowering of testosterone in men. You were one of the first to do it.
Yes.
Now, all over radio and television, I see these ads for men to boost their testosterone. Are those products good?
Well, there's so many, you know, whenever the FDA approves a new medication, or there's a lot of research that's done in another area of medicine, and they identify a specific problem, many of the other companies jump on the bandwagon and they try to produce all these products that maybe will try to do the same thing as the medication, but not quite. You know, we see this with human growth hormone. We certainly see it with testosterone and some of the natural products to help women with menopause, such as low estrogen levels. I would say some of them probably work to help with symptoms, but they don't change hormone levels. And that's one of the issues I want to address tonight is, yes, there's a lot of products out there that may help low testosterone symptoms in men, but they don't change hormone levels. And it's really the hormone levels that should be optimized as men age, because that's what's correlated with reducing the risk of heart disease. You know, the interesting thing for men today is that we now know, a recent study was actually released several years ago that showed that optimizing testosterone levels as a man ages, so that means getting their testosterone level into an optimal range, not the low normal range, but the upper 1/3 of normal limits, has been shown to reduce all-cause mortality. So what that means is for any reason of death, it reduces their risk just by optimizing testosterone. So that's such an enormous statement. It's such an enormous statement.
Does it come in a cereal?
I know. So I just think it's so important. And what I'm hearing today, fortunately, as you said, I was one of the first people to treat low testosterone levels in men in this valley. Now most physicians are actually asking, you know, men when they come in for their yearly exam, are you having any symptoms? But this is the problem with doing that. I'm really happy it's happening. Yeah. But the problem with doing that is that sometimes men, no offense, are not really in touch with how they're feeling as well as women. Yes. Yes. So often they'll say, no, I'm not having any of those symptoms. I'm not, you know, I'm totally fine. The problem is you can't really feel heart disease happening, right? It's a silent symptom. So I think that testosterone levels should be checked regardless of how a man is feeling, because so many times a man actually feels what they would interpret as normal or average when their testosterone levels are low, and then they're putting themselves at a significant increased risk for heart disease.
All right, you've opened up a lot of questions here. First of all, testing a blood test, right?
Yes.
Okay, so that's one of the panels you ask for when you do a blood test.
Yes.
All right, secondly, if you are to optimize a man's testosterone level, what's it take to keep it there?
Right. So we actually use in our office, and it doesn't matter if it's a 30-year-old male or a 60-year-old male, if the testosterone level is not optimized, we will use testosterone. We use bioidentical testosterone, which means that it's the exact same molecular structure as what their body produces. And we use that because it gives them the best effect with the least amount of side effects. And we have a pharmacy make it up for the male, so they make it up to the dose that is the right dose for them according to what their test results show. So it's very individualized. And I think that that's important because one size does not fit all when it comes to any hormones for male or females.
That's why I asked if the over-the-counter stuff is any good.
Right. The over-the-counter stuff is, again, I think it helps sometimes with energy or some of the other symptoms of low testosterone, maybe depression or irritability. Men have a tendency to feel like they've lost their drive, you know, their drive for life, their energy, their stamina, their endurance, their brain function. They find that they just feel a little bit sluggish from a cognitive standpoint. They develop more belly fat. They're in the gym working out, but they can't build muscle.
Oh, you're Nisha Jackson. I'm sorry. I dozed off.
And so when these things start happening, we start looking at how can we optimize the level so that we can really give them their life back.
Yeah.
So it needs to be individualized, and every single man's response to testosterone is a little bit different. Some men, their levels come up real quickly, and sometimes we have to change the amount of testosterone, you know, at the follow-up visit. And sometimes we actually have to change the route of administration. So you can use testosterone as a man sublingually underneath the tongue, a little tiny pellet, or you can use it as a cream form, a gel form, a patch, an injection. So there's several different ways testosterone can be used, but it needs to be individualized.
All right, any connection between testosterone, cholesterol?
Yes, so now we know that low testosterone level in men is an independent risk factor for heart disease. We know that low testosterone in the aging man doubles the risk for mortality. So they have a doubled risk of death if their testosterone level is low. So it's really pretty significant. Men have more testosterone receptors around their heart than any other place in their body. So it's very important for men to have optimized testosterone levels. And I think the problem, Perry, has been, and it's kind of like treating obesity. Many people think it's just, oh, well, we just shouldn't worry about that because that's just, you should just eat less and exercise more and everything will be fine.
Right.
Well, for so many years now, we've thought about testosterone as just the sex drive hormone for men. But now we know there's testosterone receptors all over the body for a male and a female, and how important it is to prevent prostate cancer, heart disease, dementia, Alzheimer's. You know, from head to toe, it affects a male and female. So now it's important not just as a sex drive hormone or improving that area of the man, but really to improve their whole health and to give them their energy and their life back too. And I think that this is a problem with people's stress today, is that stress lowers testosterone levels, and that is why we're seeing men who are age 30 coming in with plummeting testosterone levels because they're just under really too much emotional or physical stress.
All right, that's amazing. And by the way, if you want to join the conversation, 776-5368, we welcome you to ask questions and be a part of the conversation. Toll free, 1-800-373-5368. Can you OD on testosterone?
Yes, you can get too much testosterone, and the side effects of too much testosterone, again, this is because we treat women with testosterone too. Testosterone is very important for prevention of breast cancer in women, and it's very important for prevention of osteoporosis and also dementia and heart disease. So we treat women with testosterone too. The side effects are the same if you get too much testosterone, and that would include irritability, acne, facial hair, oily skin. So it's very easy not to get too much because testing and follow-up testing is very important. So that can be avoided according to the follow-up tests.
All right, well, let me take a quick break. We'll be right back. Nisha Jackson's in the house, and if you want to join the conversation, 776-5368. And don't forget the free seminar on cholesterol and the facts about it and heart and hormones, all of this tonight, 7 o'clock at the Smullen Center, which is right there in the parking lot of RVMC. We'll be right back. Okay, we're back with Nisha Jackson, Ventana Wellness, and again, let me remind you that tonight Nisha and Dr. Joel Klein will be doing a special seminar on the facts about cholesterol and then hormones and the heart, and it's a free seminar. It is at 7 o'clock tonight, 7 till 9 at the Smullen Center, and that's right there in the parking lot at RVMC, so take advantage of it. Beautiful venue and great information. Well, we're talking about hormones and the heart, and you're finding out that testosterone, both men and women, really helps the heart.
It does. You know, interestingly enough, all the hormones have an effect on the heart, you know, and I think that what I was going to start the show off by saying is that in medicine we get sort of stuck on a specific problem like high cholesterol. So we identify that high cholesterol is an independent risk factor for heart disease. So, you know, many years ago, we started treating high cholesterol, right, with high cholesterol medications. But really the problem is the body is too inflamed. There's too much inflammation in the body. And one of the side effects of too much inflammation in the body is high cholesterol. So instead of treating the high cholesterol, we really should be treating the inflammation. And that's one of the things we're going to talk about tonight is what's underneath the high cholesterol, and is there a better way than putting people on high cholesterol medications? Is there a better way to treat it, and what is that? So I think that's kind of the way that we're so good in medicine in the United States. We have such a sophisticated medical system, but sometimes we treat the symptom rather than the underlying cause. And I think that's one thing that we try to do at Ventana is to treat the underlying cause, because then you don't have the symptom, then you don't have the drug. And I think moving into a very different healthcare system, which we will be doing at some point, we have to start thinking about how many drugs we're using, and we have to start thinking about how can we prevent ourselves from having to go on so many medicines.
I just don't know why we're still doing the statin drug thing. I haven't read one good thing about them.
Well,
other than they may hold your cholesterol level down, but everything else kind of goes crazy.
Right. Well, and I think that's the difficult thing from an FDA standpoint when we're evaluating drugs over a long period of time, because it's a pretty strenuous process that drugs have to go through on the FDA trials to be able to come to market. The problem is that we don't really look at the whole body. And so 10 years into it, 20 years into it, 15 years into it, we realize, oh, oops, it's also affecting negatively these other systems. Because again, we're sort of single system looking at the symptom of high cholesterol. So if the drug shows to lower cholesterol or lower LDL or lower triglycerides, boom, we have a new drug. But then what happens is we start evaluating the person as they're going on and realizing, oops, we're causing all these other problems where, you know, it's causing lower body issues as far as their strength and mobility. It's causing problems with dementia, cognitive decline. So this is the concern, but I don't know if you remember, we had a physician from Florida on our show, Perry, I think it was 10 years ago, maybe longer. And he was on the show, and he was talking about a huge study that was being formed to look at the side effects of statins. And I don't know if you remember, he was from NASA.
NASA?
Yeah. And
he was going after airline pilots and everybody.
Yes.
Yeah.
And his study really was the study that ended up kind of revealing the problems with statin drugs.
Right.
And that was started years ago.
Right.
And he was absolutely dead on. I mean, he was absolutely right that the statins are causing these problems in many people. And so I think you have to weigh the risks and the benefits of really putting somebody at a lower risk for heart disease if they really have risk factors. But what ended up happening was we just started putting everybody on statins. You have high cholesterol, you have high LDL, everyone goes on it, when maybe they weren't the best candidate for it. And those are the people we really want to address tonight.
All right, again, tonight, 7 o'clock, it's free. It's going to be at the Smullen Center from 7 to 9. It's right there in the parking lot at RVMC. All right, back to testosterone, what are some of the signs of low testosterone?
Yes. So some of the signs of low testosterone would be fatigue, poor mental performance, so memory, concentration.
Poor what?
I always fall for that. Poor mental performance.
Yeah.
Depression, irritability. Men get very grouchy when their testosterone level's low. And I often hear women come into the office saying, can you do something for my husband because he's really grouchy? And we all just want to clear the room when he comes in. Wow. So that actually is a sign of low testosterone. Of course, sexual performance is low, sexual drive is low. We see cholesterol levels going up. Sometimes we'll see men complaining of palpitations or racing of the heart or overreaction to stress, like they can't handle stress anymore. A big one with low testosterone, a big symptom of low testosterone in men and women is they just don't have any drive, like zest for life is gone. And that includes creativity and that's kind of sad because that leads to further depression. You know, right. They just don't feel like going to work anymore. Their passion's not there. Mm-hmm. So it really affects every area of the body. And so when we optimize testosterone, we look at improving muscle mass and we look at increasing energy levels and getting their brain working better for them. We also look at improving the cholesterol profile, which actually really does happen. Sexual performance improves, depression is lifted, they get new jobs. I mean, it's amazing to me how many men that I've treated for low testosterone come back and say, you know what, I finally got the gumption to do A, B, and C. And I just that's been on the back burner for years, and I just finally feel like I have the energy and the will to do it.
How long for a turnaround? If you all of a sudden you realize these levels are low, how long does it take to build it back up?
Well, it takes, what we do initially is we put a man or a woman on testosterone, and it's not just testosterone, sometimes it's other hormones too to get that right balance, in place. So we always do a follow-up in 90 days, in 3 months, but they'll feel the effects within a couple of weeks, the positive effects within a couple of weeks. So sometimes it'll take 2 weeks to a month to really start getting back where they need to be, and some things take longer. The first thing that we notice is their mental performance improves. That's usually the first symptom that goes away, which is great.
Well, it's an amazing thing. You're talking briefly there about inflammation. Where is that in this equation?
So inflammation is unfortunately almost always a byproduct of our stress, our quality of sleep at night, because that's when our body goes through its repair cycle. So lack of sleep reduces the body's ability to repair itself, and high insulin levels, which comes from the food that we're eating. So if our diet is a toxic diet, we will have a lot more inflammation in our body, which leads to all sorts of issues, chronic pain, poor mental performance, hormone imbalance. So if you have a combination of low hormone levels and a toxic diet, lots of stress in your life, and you're not sleeping well, which honestly, Perry, that is so many people.
Yeah.
I would say maybe that's even more people than not. And so if you have all of those things together, you're not going to feel well, and you're going to have a pretty poor hormone level when you, a grouping of hormone levels when you come in. So that's what we really want to try to address, is not just changing the hormones, but how do you change your life? How do you change your diet? How can we impress upon our patients how important it is to sleep and manage their stress?
Do you recommend sleep aids?
I do recommend sleep aids because the sleep, whether it be a prescription or a natural sleep supplement, sleep is so vital to getting better. And like I said, it's helpful to provide hormone balance and get them on track with their hormones, but they have to do the other things in order to feel really well. And I don't like people to go 50%. I want them to go all the way as far as feeling better. And so part of it falls back on the patient really taking it serious, getting serious about taking care of themselves. So there is some personal responsibility there too.
All right, again tonight, give us a recap of what are you and Dr. Klein doing tonight.
Yes, so Dr. Klein will be talking about high cholesterol medications, how you can maybe prevent going on them or getting off of them, He's going to be talking about some of the facts that maybe you've never heard of before about cholesterol and heart disease. That is even new information that has come out. And then I will be talking about hormones in the heart. I'll also be addressing estrogen, progesterone, testosterone for men and women and what it does for the heart and how important it is to get balanced.
Is tryptophan a natural sleeping aid?
Yes.
So
yes.
we should have a lot of turkey a week from the day?
Tryptophan. So yeah, eat turkey and sleep well. Yes.
Fascinating. All right. One other question. I know that it's just an obvious answer, but where does water come into all of this?
Well, water just improves hydrating every area of your body. And I always use, and you know...
By the way, that's water. I just want you to know.
Not mine. Water is so important because if you're feeling tired in the afternoon, the absolute best thing you can do is drink 8 ounces of water. Because I always say it's like those little wilting flowers on your front porch. As soon as you pour water on them, they just come back to life. Your body does the exact same thing. So hydration is very, very important.
All right. Now, people who are highly stressed will start doing crazy things like a lot of sugar, possibly alcohol, and these things. So obviously that's just compounding the problem.
It is. It's this terrible vicious cycle, Perry, where when you are not feeling well about yourself or you're under a lot of mental pressure or stress, you start doing everything that is destructive to yourself, only making the problem worse. And then when you feel worse, you continue to behave bad.
Yeah.
So getting back on track is the key. And many people don't connect these dots. They don't put all these things together. And I'm hoping that that's what we can do tonight is connect the dots for people.
Well, I want to encourage you. This is a real opportunity. Hear Nisha speak and Dr. Joel Klein. 7 o'clock tonight, Smullen Center. That's right there in the parking lot at RVMC. It's free, 7 to 9. What a great opportunity. And if any of this kind of resonated with you and you're feeling that and you go, yep, that's what I'm feeling, let me encourage you, call Ventana Wellness and make an appointment. Go online, ventanawellness.com. Okay, thanks.